In this video, we'll be discussing the use of QALY-based assessments and their impact on patients. Let's talk about value assessments. These are complex economic frameworks that help determine whether the price of a treatment is justified by the value of the treatment. It's a cost-benefit analysis. These assessments include several factors such as a treatment's efficacy, cost, potential risks, and larger impact on society. For instance, will people who receive a treatment be able to return to work and be productive? One value assessment tool that's gained traction among health plans and pharmacy benefit managers is the QALY. QALY stands for Quality Adjusted Life Year. QALYs are used to assess whether the cost of a treatment corresponds to the potential benefits to the patient. Basically, it creates a formula that includes quality of life and quantity of life. That formula is even expressed as a dollar amount. One full year of perfect health is valued at roughly $100,000 to $150,000. Pause for a moment and ask yourself what that means. What does perfect health look like and to whom? For example, QALYs often determine value based on physical mobility, which devalues the experiences of people with disabilities. QALYs also use life expectancy as a common value, which devalues the experiences of older patients. In some other countries, these assessments are widely used and have resulted in cancer patients, for example, having no access to drugs that patients benefit from in the U.S. Former Congressman Tony Coelho explains how QALYs can unfairly and dangerously impact some patients.
Let's take, for example, there's Jane Doe. She's 55 years old. She's developed cancer. Her treatment is probably going to cost $125,000 a year. But QALS says that she's only worth $100,000 and that she shouldn't be getting the treatment at all. She's denied. That's wrong, totally wrong. What they do is they take this, whether your life expectancy is, your age, put that together and determine whether or not it's worth it for them to spend X amount of dollars on you as an individual. And it can be, they may decide that it's $100,000 a year or $50,000 a year, and if it's $55,000, it's denied. It's a very arbitrary thing, but it's sort of general in nature. And they always say, look, it's only a formula. It's not applied to an individual. I can go to Canada, I can go to France, I can go to England, and this isn't just a formula. They apply it to individuals specifically, and care is denied because of it.
To recap, QALY stands for Quality Adjusted Life Year and is a measure that attempts to put a value on the quality and quantity of life. But the assumptions QALYs make about quality of life are subjective and discriminate against patients based on age, disability, and chronic conditions. Healthcare coverage decisions based on QALYs are similarly flawed. Make sure the insurance plans being offered to your employees aren't based on this unfair and discriminatory valuation process. To learn more about how utilization management can affect patients, please refer to the booklet Best Practices for Prescription Drug Benefit Design, available at cancercare.org, and view the other videos in this series.